Hello and welcome to another installment of SkinVersal.com with me, Alicia. On today's video, we will talk about a skin condition called psoriasis. If you have been living with psoriasis for years and you are looking for the best solution for your condition, you might want to stick around as this video might pleasantly surprise you. In this video, I will share with you a natural and effective method that will allow you to make all the lesions, scales, and flakes disappear. Psoriasis is a long-term chronic skin problem that causes skin cells to grow too quickly, resulting in thick, white, silvery, or red patches of skin. Normally, skin cells grow gradually and flake off about every 4 weeks. New skin cells grow to replace the outer layers of the skin as they shed. But in psoriasis, new skin cells move rapidly to the surface of the skin in days rather than weeks. They build up and form thick patches called plaques. The patches range in size from small to large. They most often appear on the knees, elbows, scalp, hands, feet, or lower back. Psoriasis is most common in adults, but children and teens can get it too. Having psoriasis can be embarrassing, and many people, especially teens, avoid swimming and other situations where patches can show. But there are many types of treatment that can help keep psoriasis under control. Several types of psoriasis exist. Among the most widespread ones includes plaque psoriasis. The most common form, plaque psoriasis, causes dry, raised, red skin lesions covered with silvery scales. The plaques itch or may be painful and can occur anywhere on your body, including your genitals and the soft tissues inside your mouth. Nail psoriasis. Psoriasis can affect fingernails and toenails, causing pitting, abnormal nail growth, and discoloration. Psoriatic nails may become loose and separate from the nail bed and may cause the nail to crumble. Scalp psoriasis. Psoriasis on the scalp appears as red, itchy areas with silvery white scales. You may notice flakes of dead skin in your hair or on your shoulders, especially after scratching your scalp. Goutte psoriasis. This primarily affects people younger than 30 and is usually triggered by a bacterial infection such as staph throat. It's marked by small, water drop-shaped sores on your trunk, arms, leg, and scalp. The sores are covered by a fine scale and aren't as thick as typical plaques are. You may have a single outbreak that goes away on its own, or you may have repeated episodes, especially if you have ongoing respiratory infection. Psoriatic arthritis. In addition to inflamed, scaly skin, psoriatic arthritis causes pitted, discolored nails and the swollen, painful joints that are typical of arthritis. Although the disease usually isn't as crippling as other forms of arthritis, it can cause stiffness and progressive joint damage that, in the most serious cases, may lead to permanent deformity. The cause of psoriasis isn't fully known, but is thought to be related to the immune system and its interaction with the environment in people who have the genetic susceptibility. It is not clear, however, that genetic factors alone determine whether one develops psoriasis. Psoriasis is not contagious. It cannot be spread by touch from person to person. Doctors believe that the immune system is a factor in the development of psoriasis. This is because increased number of white blood cells are present between the abnormal layers of skin and because psoriasis responds to drugs that suppress the immune system. This causes an ongoing cycle in which new skin cells move to the outermost layer of skin too quickly, in days rather than weeks. Dead skin and white blood cells can slough off quickly enough and build up in thick, scaly patches on the skin surface. This usually doesn't stop unless treatments interrupt the cycle. Psoriasis typically starts or worsens because of a trigger that you may be able to identify and avoid. Factors that may trigger psoriasis include infection, such as strep throat or thrush, injury to the skin, such as a cut or scrape, bug bite, or a severe sunburn, stress, cold weather, smoking, heavy alcohol consumption, and certain medications, including lithium, which is prescribed for bipolar disorder, high blood pressure medications such as beta blockers, anti-malarial drugs, and iodides. There are several types of psoriasis. Symptoms for each type may vary in severity and appear in a wide array of combinations. In general, the major symptoms of psoriasis include bright red areas of red patches or plaques on the skin, often covered with loose, silvery scales. Plaque can occur anywhere, but commonly they occur on the knees, elbows, scalp, hands, feet, or lower back. Nearly 90% of people with psoriasis have plaque-type psoriasis. Tiny areas of bleeding when skin scales are picked or scraped off, or Auspitz signs. Mild scale into thick, crusted plaques on the scalp. Itching, especially during sudden flare-ups or when the psoriasis patches are in the body folds, such as under the breast or buttocks. Conventional treatments to psoriasis include products applied to skin, phototherapy, and oral medicines, which can help control psoriasis. Most cases are mild and can be treated with skin products. In some cases, psoriasis can be hard to treat if it is severe and widespread. The purpose of conventional treatments is to slow the rapid growth of skin cells that causes psoriasis and to reduce inflammation. Although they do alleviate some of the symptoms and provide temporary relief, but most psoriasis returns even in mild forms. The power of home remedies, however, are not to be overlooked. For centuries, certain natural ingredients and substances have been able to cure or have a positive effect on almost any skin condition. All of these remedies can be made from home and are also typically less expensive than other alternative forms of medicine. Generally, homemade remedies are harmless compared to other forms of modern medicines and rarely cause reactions or side effects. The natural shift back towards home remedies is slowly gaining momentum. More and more people are now looking into their own kitchens and gardens to find natural cure for daily ailments. Almost every illness will have a natural remedy. For more on how these home remedies can help you get rid of your psoriasis, please visit skinversal.com. Our website also features a number of articles on various skin disorders and diseases, as well as their corresponding treatments. That's it for today's video. Be sure to leave a comment, rate my video, and don't forget to hit that subscribe button. This is Alicia signing off. Ciao!